and go live. Ok, nan ton title video. Ok, alors, ou même qui là ensemble avec moi, ouvrez le livre dans le chapitre premier. Si vous avez un livre là, il y a quelqu'un nous connaît pas un livre là, qu'il faut qu'on gagne. Parce que côté, plus tard, bien demain si Dieu veut, pour me faire connaître qu'il est pour vous venir prendre le livre. Ok, nous allons aller dans la première page là. On fait ça ensemble. OK? The nursing assistant in long-term care. OK? Yeah, on met à joindre moun qui gagne là en attendant livre pour là, livre. OK? Alors, thank you. All right. So, on fait un petit avancé. Long-term care. So, nursing assistant, ça c'est ou même. L'on fini avec programme, non, va devenir un nursing assistant. Okay, so when you finish with the program, you're going to be a what? A nursing assistant. Nursing assistant mostly work in long-term care. Okay? Travaille plus souvent dans long-term care. What is long-term care? Read it for me. What is long-term care? No. Let's read. Long-term care. Go ahead. Tout le monde a pratiqué lecture là.
Facility for people who need 24 hours
skilled care. Very good. So when we talk about long-term care, we're talking about things like a nursing home. Okay? Long-term care facility is a what? Is a nursing home. Very good. Very good. In the nursing home or in the long-term care facility, patient receive skilled care. What is skilled care? Very good, very good, very good. Alors, c'est très bien ça. So skilled care is care that is medically necessary. When the patient come in, le patient vient dans nursing home, no? When the patient come in, some people stay for a very long time. Some people don't stay for a very long time. Okay? Gen moun ki rete pour longtemps, gen moun ki pa rete pour longtemps. They call that different length of stay. Length of stay is the amount of time the person stay in the long-term care facility. Some of them receive skilled care. I'm recording. Some of them receive skilled care. Some of them have different illness. What is terminal illness? Some of them have terminal illness. What is that? Okay, so a terminal illness is an illness that will cause the patient to die. It will eventually cause death. C'est une maladie qui peut tuer patient quand même. Okay? Example of terminal illness. Give me an example. Give me an example de terminal illness. Cancer. Say cancer. Very good. Now, some patients have chronic illness. What is a chronic illness? All right. Et pour tout le monde à participer. Faites-moi des noms. Let me hear you.
This means the condition lasts a long period of time.
The condition lasts a long period of time. Example. An example of chronic condition is what? From your example of chronic condition. Diabetes. Say diabetes. What else? Long chronic condition. High blood pressure. Hypertension. That's a chronic condition. Now, patients have different illness, different health problems, right? The doctor will decide the name of the illness. We call that diagnosis. Okay? What is a diagnosis? The diagnosis is basically the doctor that does the test. Docteur a fait plusieurs tests pour décider qui non maladie ça gagne. The doctor does many tests to decide the name of that illness. On allant page 2, page 2. Some people stay at home to receive care. Some people stay at home to receive care. What is a home health care? Gazi.
Provided in a person's home. This same type of care is generally given to people who are older and are chronically ill, but who are able to and wish to remain at home.
Very good, very good. So chronic health care, home health care is for people who want to stay home and who can stay home. C'est pour moun qui capable et qui vle rester la caillou pour continuer joindre soin. What is the assisted living?
Residence for people who need some help with
Daily tasks.
daily tasks.
Such as showering.
And
Very good. So assisted living patient, they need some help. Okay? What about adult day services? What is that? Tell me. Adult day services.
for people who need some help and supervision during certain hours, but who do not
Who do not live. Is provided. Pendant la fait pratique ça, je vous forcer tête pour faire lecture. Okay? All right, very good. Okay, some people will receive acute care. Okay, what is an acute care?
Hospital and surgical centers.
Okay. A hospital or different surgical centers. Okay. So, le patient commence les faits. Nous allons subacute care. When patient begins to get well, they are transferred to what we call subacute care. Subacute care. Let me just remove this. Okay. Very good. Very good. So, subacute care. Now, when your patient goes to the doctor's office, we call that outpatient. Okay? What is outpatient care?
is caregiving in hospital or long-term care facilities. That's it.
No, outpatient care. Outpatient
care is given to people who have had treatment,
procedure or surgery and need short-term skilled care. All right? Very good. Very good. Now, some patients will receive rehabilitation, right? What is rehabilitation?
Rehabilitation is therapy, and professional, physical,
Occupational, speech therapy,
help restore and improve
function after an illness or injury. Very good. So some patients will receive outpatient, subacute, acute care, etc. What about hospice care? What is hospice care?
is giving intensity or home for people who have 6 months or less to live.
Very good. Hospice care is care given to people who have 6 months or less to live. Le patient pral mourir, qui genre de soins li joignent? Hospice care. When the patient is going to die, they receive hospice care. Now, on the list I give you, now list about New York, right? You have to understand the typical long-term care facility. Okay? For comprendre, typical long-term care facility, qui qualité soins patient joint. What type of care patient get? Example, page 3, non page 3. Patient gets activity of daily living care, physical therapy, occupational therapy, speech therapy, wound care, different types of tubes, nutrition therapy, right? Management of chronic diseases. Alors, dans un nursing home, patient capable de joindre différents types de soins. Okay? No one? So in a long-term care facility, they get all of that. All right. Now, patient needs to get person-centered care. Okay? Person-centered care. What is person-centered care? Si j'ai bon cali. Person-centered care emphasizes the individuality
of the person who needs care.
And recognizes and develops the person's capability. Person-centered care revolves around the resident and promotes her individual preferences, choices, dignity, and interest. Very good. Very good. All right. So, pendant qu'on fait ça là, pratique ça là, ou ka ouais que capacité lecture a augmenté, pas vrai? So, persister. Very good. What is trauma-informed care? What is trauma-informed care?
Is patient care that
May have experienced trauma in their life. Trauma can come from witnessing or experiencing abuse or neglect, violence, prison, or military combat. Very good, very good. Alors, pour nous avancer un petit peu plus rapide, Medicare, Medicaid, that federal insurance to pay for health care. OK? Medicare, Medicaid, c'est assurance fédérale pour payer soins de santé. OK? Let's go to page 4. OK. Describe the role of nursing assistant. Qui rôle nursing assistant gagne? Okay. We call, so a nursing assistant, let's go. Assistant performs assigned nursing tasks. Awesome. Measuring a resident's temperature. A nursing assistant also provides personal care, such as, go ahead, bathing the residents, helping with hair care, okay, duties include bathing, exercises and ambulation, transferring. So, so you can stop now. So basically, you have the list here. Ou gen liste de activités que nursing assistant doit performer. You have the list of activity that the nurse assistant needs to perform. Now, when you do your job, you have to observe the patient. You have to do one more thing we call charting. What is charting? Page 4. Qui sa charting nan ye? So charting is documenting. Documenting nan ki sa liye, c'est écrit wap écrit sorti faire. So with documenting, you write down what you did. Okay? Very good. Now, the care team, page 5. When we talk about the care team, we're talking about a group of healthcare professionals, a group of people who are working together to take care of the patient. Là, on a parlé de care team, non? On a parlé d'un groupe de monde qui travaille ensemble pour prendre soin. Qui est? Very good. So, in the care team, we have the nursing assistant. Okay? Read the first sentence for me, what the nursing assistant does. Les premières phrases que sa nursing assistant fait.
The nursing assistant performs assigned tasks,
measuring vital signs. One more. Provides and assists with such as bathing, okay. No même paragraph, same paragraph. How many hours of education that the nursing of training that the nursing assistant needs? Very good. The registered nurse. Tell me something about the registered nurse.
In a long-term care facility,
a registered nurse coordinates, manages, and provides skilled nursing care. Very good. This includes, unfortunately, giving special treatment, medication as prescribed by a doctor. Who prescribes the medication? The doctor. Who gives the medication? The nurse. Very good. On sait de petites questions de base. On sait de petites questions très légères que vous pouvez répondre. Very good. All right. What does the LPN do? What does the LPN do? Qui ça LPN n'a fait? Page 5. Vocational nurse.
Give medication and treatment. An LPN or LPN is a licensed professional who has completed 1 or 2 years of education and has passed national
Licensure examination. Very good, very good. What is the job of the physical therapist? Cherchez physical therapist là. Qui ça que c'est job li? Evaluate. Physical therapist. To increase movement. Improve circulation. Promote healing. Reduce. Prevent. And very good, very good. What does the occupational therapist do?
Occupational therapist
Mhm.
residents learn to adapt to disability.
Tout le monde a essayé. Everybody, come on, tout le monde.
And train residents to
Mhm.
perform activity of daily living to disability and residents to perform activity of daily living.
Okay, good job. Assistive device. Okay. Assistive device, qui ça y est, c'est une série de matériel que vous utilisez pour aider patients pour devenir plus indépendants. So assistive devices are things that they use to help the patient become more independent. Okay? All right, let's go to the next page. Okay? What is the job of the registered dietitian? Qui ça qui c'est job registered dietitian?
Registered dietitian.
Uh-huh.
Registered dietitian,
Nutritionist assesses a resident's nutritional status and develop a treatment plan and manage health. Nous n'avons page 6. Okay. All right. Et pour tout le monde participer. Everyone needs to participate. Okay? Page 6. When we talk about the dietitian. What is the job of the medical social worker? Page 6. Social worker. Services such as counseling and financial assistance. Very good. So, social worker, li aider patients joindre des services sociaux, tant que counseling avec services financiers. Okay? So, social worker helps the patient to get financial services and counseling as well. Okay. Tell me about the resident and family.
Resident is an important member of the community,
Providing person-centered care, which means placing the resident's well-being first and giving her the right to make decisions and choices about her own care. Very good. What is the chain of command? Qui ça qui c'est chaîne de commande? Page 6. It describes the line. Noélie? Chain of command. Chaîne de commande. Page 6.
Okay.
It describes the line of authority and helps to make sure very good, very good. So, chaîne de commande là, c'est en ligne d'autorité. Okay? Very good. Liability means what? Qui ça liability veut dire?
It means that someone can be held
for harming someone else. Liability, c'est en terminologie légale, c'est un terme légal qui dit que ou responsable pour patient, ok, et yon moun qui fait patient mal là, li responsable tout pour mal li fait patient. Okay? So it means that someone can be held responsible legally for harming the patient, for harming someone. Okay? Very good. Okay. Alors, dans chaîne de commande là, gagne nurse, physicothérapie, docteur, dietitian, etc. Okay? So it's a group of people. In the chain of command, we have different disciplines. It is a group of people who work together to take care of the patient. They all have liability. Dans chaîne de commande là, tout le monde qui sa liability. Ça veut dire ou responsable pour service ou bien bon service ou mauvais service que vous faites par patient. Your liability means that everyone is responsible for the good and the bad or the bad service that they give to the patient. Very good. What does it mean? Scope of practice. Qui ça scope of practice la veut dire?
Define the task that healthcare providers are legally all right to do according to state or federal law.
Now, scope of practice veut dire que il définit responsabilité travail que ou gagne que healthcare provider li légalement gagne droit pour le faire. Okay? So, scope of practice is what you are legally allowed to do. C'est ça la loi bon permission pour faire d'après métier qui n'en met on. This is what the law allows you to do based on your profession. So, scope of practice. When we say someone is operating inside of their scope of practice, ça veut dire, that means the person is doing what they're supposed to do based on their profession. Là, nous disons qu'on a opéré en dans scope of practice, ça veut dire qu'on a performé des procédures que l'on fait training pour ça et la loi permet pour le faire. Now, question. Inside of your scope of practice, you're doing everything you're supposed to do, right? Now, what does it mean to operate outside of your scope of practice? Qui ça veut dire pour opérer en dehors du scope of practice? See inside, under what fait ça ta dwe fait, outside, voila. Outside of your scope of practice means you're doing something you're not supposed to do. Okay? For example, you are a CNA. Don't go pretend or act like you're a nurse. Pas propose nurse ou pas faire travail nurse là. Tant qu'on buy médicaments. You're not supposed to give meds. You're not the nurse. Make sense? Fulay sa ap trop pou la kouke nan gagan. Okay? So, do only what you are allowed to do. What is the care plan? What is the care plan, guys?
The care plan is individualized for each resident. It is developed to achieve the goals of care and meet the residents' specific needs.
Treatments that the team members, including NA nursing assistant, must perform. So, care plan nan ki sa liye, c'est un plan de soins que care team nan développé et qui dit tout le monde qui sa pou yo faire pour patient. So the care plan is a plan of care developed by the care team, and it tells everybody what their job is and what they need to do for this particular patient. C'est aussi simple que ça. OK. Page 8. On allait dans page 8 là. Okay. Now, as an employee, a CNA is an employee. C'est un monde qui a un job nommé. Okay? The facilities have policy and procedures that you must follow. Okay? Facilité koto travail, you give policy and procedure que doit suivre. What is a policy?
The policy is the course of action that should be taken every time a certain situation occurs.
Very good. What is a procedure?
A procedure is a method or way of doing something. For example, a facility has a procedure for reporting information about information.
Very good, very good. Bam quelques exemples de policy procedure. Give me some examples of policy procedure. Example number 1, all resident information must remain
Confidential.
Let's read that again.
All resident information must remain confidential.
Continually, continue.
Information confidential means not telling anyone about it.
Very good. Policy number 1. Everything you know about the patient, it's a secret. You can't tell people. Tout ça qu'on connaît de patient, c'est secret, c'est confidentiel. Ou pas qu'à marcher dit l'autre monde. Voilà. Policy procedure number 2. The care plan, on met ensemble.
The care plan must always
Be followed. Continuez.
tax not listed
In the care plan. All right, now approved and performed. Okay, on va prononcer ED. Approved and performed. Okay, so care plan now for poursuivre. All right, policy procedure number 3. Nursing assistant should not do tasks that are not included in the job description. Là, n'a parlé de policy procedure. Hand washing, infection control is a policy procedure. When we talk about policy procedure, infection control is one. Okay, so as a nursing assistant, you are a professional. What does it mean to be, what does professional mean?
Having to do with work or a job.
What does it mean? What does professionalism mean? Professionalism. Professionalism What is professionalism? Professionalism is behaving properly when on the job. Toujours, next phrase. It includes dressing appropriately and speaking well. It also includes being on time, completing tasks.
And reporting to the nurse.
Very good, very good. A professional relationship with residents include the following. Là, page 8 là. Let's read. A professional relationship. Come on, on lit ensemble. A professional
relationship with residents includes
the following. Providing. Number 2.
Keeping a positive attitude.
Number 3. Is trained to do. Number 4.
Keeping our resident information.
Number 5.
Always being
Polite. Number 6. Number 7. Page 9. Very good, right? Ou pas supposé utiliser téléphone nous pendant ou bail un patient soin. Pendant qu'il est patient ou bien on en chambre patient ou pas supposé dans téléphone. You're not supposed to be using your phone while caring for the resident. Okay. Now, page 9, a professional relationship with your employer includes, nous voyons ça? On nous lit ça ensemble, lisons ensemble. A professional relationship with an employer includes, number 1, efficiently. Number 2,
always following policy
procedures. Number 3,
documenting and reporting carefully and correctly.
Number 4,
Reporting problems with residents all times.
very good. Number 5, one more.
Good working and
Duties. Very good. What does compassionate mean?
Being caring.
Being caring. Concerned. Corpo qui qui pas participer, passez devant moi, tant pis. Ou même avec moi quand même, passez devant, venez chita devant, tant pis, venez. Nous pas venir chita derrière là pour nous faire ça nous connaît qu'on parle en pile. Venez chita devant. Pour l'on pas participer, on va faire quoi pour cette chose. Venez fois que chita devant moi, je pas pas. Mais d'accord. Voilà. Bon, on met pour ça. Bien pour. Et nous dégager. Ok, dégage. Ok, from when I participate, from where bouche nous a bat, n'a forcé répéter moyo. Ok? And because you have to try. For fair say, all right? What does empathy mean? Come on, let's work. What does empathy mean?
Empathy means
Identifying people who are compassionate,
understand others' problems.
very good.
They care about them.
What does sympathy mean?
Sympathy means sharing in the feelings and difficulties of others.
What does it mean to be honest?
An honest person tells the truth and is
Trusted.
trusted.
So honest means don't lie to the patient. Parle by passer en menti. Okay? Now, what is tactful?
Tactful means
Showing
sensitivity and having a sense
Up.
of what is appropriate when dealing with others.
What does it mean to be conscientious?
Conscience try to do their best.
Continue.
They are
Guided.
by a sense of right and wrong.
What does it mean to be dependable?
Dependable, just assistance, must be able to make any
Commitment.
commitment.
Ou met prononcer le mal. I don't care.
They must be at work on time.
Very good. Very good. All right. So turn the page. Tell me about patient. What does it mean to be patient?
People who are patient,
People who are patient do not lose their temper easily. Very good. You prend patience, you prend sang you pour faire travail. They take their time. What does it mean to be respectful? Come on, respectful. Individuality. This includes their
age, religion, and business.
Very good. What does it mean to be proactive? Means anticipating potential problems and needs before they occur. Very good. Nursing assistant who pay close attention to residents and their environment are more likely to anticipate needs and prevent problems. So, leur prêter attention à ça qui est going on avec patient ou capable ouais qui problème qui t'a pas développer pour éviter. When you pay attention to what's going on with the patient, you can see what problem was going to happen and you can work to prevent it. What does ethics mean? Ethics are the knowledge. Continuez.
Person has a sense of
Duty.
toward others.
So ethics means moral law. Loi morale. Okay? Ethics veut dire quoi? Okay, that means moral law. Okay, guideline. Toutes les fois arriver sous guideline, peser frein pour capable étudier guideline. Parce que c'est là dans l'examen d'état sorti. Anytime you get to the guideline, hit your brakes because that's where exam will come from, okay? Guideline number 1. Be honest. All time. Protect. Next, keep staff information confidential. Come on, another some. Or suspected abuse. Next, follow the care plan and assignment. Do not perform any task outside your scope of practice. Very good. What is Omnibus Budget Reconciliation Act, OBRA? The Omnibus Budget Reconciliation Act, OBRA, was passed 1987. Very good. OBRA qui s'allie, c'est une loi qui était passée en 1987. Okay? You must also, okay, so OBRA requires that the nurse aid training and competency evaluation program sets minimum standard for nursing assistant training. Combien heures de temps pour CNA a fait dans classe? How many hours in class?
75 hours.
Very good, 75 hours. How many hours of in-service per year? Combien heures de temps de in-service par année? It's in the middle of the page. In the middle page là, cherchez. 12. Good job.
12 hours.
Very good. Very good. Okay. Dans en bas page là, il parlait de survey. What is a survey? Page 11. Surveys are at the bottom of the page. Surveys are inspection. You see that? Soulier ça dans le caillou, dans le livre. Surveys are inspection to make sure that long-term care facilities follow state and federal regulation. Know what that? Survey. Very good. Surveys are inspection. On nous lire ensemble. Surveys are inspection.
To make sure
Mm-hmm.
that long-term care
Awesome. Go.
surveys
Are
inspections
Mhm.
to help make sure that the long-term care facilities
follow state and federal regulation. Chaque année, l'État voyait un département bien spécial à faire investigation, à faire ça les surveys pour make sure que nursing home nan, ou bien l'hôpital là a suivre ça la loi bayo pour faire pour patient. So survey, they send a special department to survey the facility. Okay. Resident rights, that's why you a little patient right. Sometimes they call it patient right or client rights. Okay? So page 11, OBRA, ensemble, also identifies rights for in
long-term care
facilities. Resident rights specifies how resident must be treated. Faithfully. While living in a facility. On nous lit encore. Let's read it again. OBRA
also
identifies important rights for residents in long-term care facilities. Resident rights specify how residents must be treated while living in a facility. Okay. Now, on that dernière phrase dans paragraphe ça, the last phrase, the last sentence, resident rights include the following. Qui ça qui c'est resident rights là? Resident right is what? Quality of life. You see that?
yeah,
Quality of life. Next, service and activities to maintain high level of wellness. Next, the right to be fully informed about rights. On nous verra page là. Next page. One more. The right
participate
in their own care. Droit pour participer dans soins pour peut-être pas yo. Okay. The right to make what? Independent choices. Another say. The right to privacy and confidentiality. Munde, yo fais m'tande voix nou, come on. The right to privacy and ma fait exercice pour nous, ma fait pratique là, oui. Anglais monte highway déjà, ou même anglais water. On avance. Let's use that English muscle. Okay, on avance. The right to privacy and confidentiality. This one be back. The right to dignity.
and freedom.
Okay. The right to security of possession. Okay. Right during transfer and okay. Right to complain. Right to rights with. Very good. So, Laura Lakayou, faut prendre un petit temps pour écrire définition yo. You have to take time to write down the definitions. C'est seul ça pour garantir que vous allez passer examen l'État. That's your guarantee that you're going to pass the state exam. Okay? Because, j'aime d'ap montre là, il y a une liste de terminologie que vous allez servir avec you. They're going to use the terms to ask you questions. Very good. Okay. Protecting residents' rights. Question number 1. Never, ensemble, never abuse a resident physically, psychologically, repeat psychologically, verbally, or sexually. Next one. Call. On a l'autre là. The next one. Involve. Allow. Choices. One more. Always. Very good. One more. Unnecessarily expose a resident while giving. One last one. Respect. Very good. Nou met Kabila. Good job. Next page. Go page 14. Go to page 14. Alors, où est-ce en mangeant l'appétit vient, n'est-ce pas? Right? So while you're reading with me, you're gonna like doing the reading because you're learning so much. Okay? Li pas normal côté passé dans Boston Healthcare Institute et puis ou arriver dans job interview pas qu'à parler. Right? Li pas normal pour t'es là et pour pas qu'à passer examen d'état. It's not normal that you came from Boston Healthcare Institute and you can't speak English or you can't pass the state exam. No. I don't want that. Okay? Very good. What is abuse? Page 14. What is abuse? Montez voix, nous. Propose ou pas langue abuse.
Abuse is mistreatment that cause physical, mental, or emotional pain or injury to someone.
Very good. What is physical abuse?
Physical abuse is any treatment, intentional or not, that causes harm to a person's body.
Very good. What is psychological abuse? Tout le monde participe, moi. Fais-moi bouger marcher. Intimidating. La guerre anglais à l'école. La guerre. Very good. What is verbal abuse? That threatens. Say threatens. Embarrass or insult a person. What is sexual abuse? Is non-consensual sexual contact of any kind. Again, what is sexual abuse?
Of any type.
What is financial abuse?
Financial abuse is the improper or illegal use of a person's money, possession, property, or other assets.
What is assault? What is assault?
Assault is a
Threat. Fearful that they will be harmed. What is battery?
Battery is
What is domestic violence?
Domestic violence is abuse by
Intimate partners.
Of family members.
Continue.
Sexual, or emotional.
What is false imprisonment?
False imprisonment is
Unlawful restraint that affects
a person's freedom of movement, above
the threat of being physically restrained or actually being restrained are types of false imprisonment. Very good. What is sexual harassment? Page 15.
Sexual harassment is any unwelcome sexual advance or
Behavior that creates an intimidating, hostile, or offensive work environment. Okay, very good. What is neglect? Is the failure
to mental, or
emotional harm to a person? What is negligence? Come on. Actions the proper care for a resident resulting in unintended injury. What is malpractice? Malpractice occurs
when a person
injured due to professional misconduct through negligence, carelessness, or lack of skills. Partie qui parlait de observing and reporting, non? Faut aller étudier. So the part that talks about observing and reporting abuse and neglect, you must study that part. Okay? All right. Now, what is a mandated reporter? Qui ça qui c'est un mandated reporter? Li pa écrit dans le livre là non, mais définition c'est un petit phrase tout court qui est écrit en lettres foncées. Come on. What is a mandated reporter? Or suspected abuse is not optional. It is the law. Voila. A mandated reporter is someone who must report abuse. Very good. Let's go to page 16. Ombudsman. What is an ombudsman? Awesome. Levez-vous à nous. An ombudsman is assigned by law as a legal advocate for. Very good. C'est un monde que la loi by job pour on sort d'avocat pour combattre pour patient, pour goumer pour patient. So the ombudsman is a person that the government says your job is to fight for this patient. Okay? What is confidentiality? Private.
Confidential information about
So confidentiality means keeping private things that are private. Information que vous avez des patients li privé. What is a HIPAA? What is HIPAA? Congress passed the health insurance. Répétez, health insurance portability and accountability Act. Congress passed ensemble. Congress passed the Health Insurance Portability and Accountability Act. In what year? In 1996. Very good. One reason this law was passed is to keep health information private and secure. Let's read that together. One reason this law was passed, ensemble, this law
was passed is to have information private and secure.
Very good. What is protected health information? What is protected health information?
That can be used to identify a person and
Relates.
condition, any record that the person has had,
very good. So, ensemble, let's read together. Protected health information is information that can be used to identify a person and relates to the patient's condition, any health care that the person has had, and payment for that health care. Very good. Now, guidelines. Let's do the guideline together. Protecting privacy. Pas oublier de l'arriver sous guideline, you faut étudier. You must study the guideline. Number one, make sure in a private area when you are listening to or read your message. Know with whom you are on. Number three, do not talk about residents in public. Number five, use confidential rooms for reports. Number six,
if you see a resident family member or a former resident in product, be careful with your
Finley tout ça net.
The family member or former resident may not want others to know the person is or was resident.
Very good. One more.
Do not bring family or friends to the facility to be residents.
Very good. And one last one is?
Make sure nobody possess health or personal information on your computer screen or
the browser. Now, ça très important sobre là. This is important. The rest you're gonna read. The next one. Do not give. One more. Do not share resident information. Photos. Pas prendre photo. Video. Don't take videos. Very good. So, don't take pictures of your patient. Pas prendre photo. Don't do video. Don't post on Facebook. Don't post on Instagram. That is against the law. Okay? Now, what is the medical record? Qui s'axe medical record là?
Next page.
Same page, page 18. The resident's medical record
There was no medical record or shot
is a
document
in court. What is included in the chart is considered to be what actually happened. Very good, very good. All right. Careful documentation, guideline. Document care immediately after it is given. Qui l'a documenté care? When do you document care?
Document care.
Focus, mama.
Document care immediately after it is given.
Next one. Think about what you want to say before documenting. Next one. Use facts and no opinion. Very good. All right. What color pen or ink do you use? Page 19. Use black ink when documenting by hand. Noël n'a pas utilisé ça? Use black ink when documenting by hand. Next, if you make a mistake when documenting by hand, draw one line through it. Write ensemble. Recommencez encore.
If you fasten to use electronic documentation, you will be trained how to do this. Some facilities use both handwriting and electronic.
If you make a mistake,
On recommence now if you make a mistake. Let's go back to if you make a mistake.
If you make a mistake when documenting by hand, draw one line
Through it.
write the current information.
Put your initial and the date. Do not erase what you have written.
Do not use correction. Documentation done on the computer. It is time it can only be changed by entering another notation.
Very good, very good. All right. Okay. Documentation may be done using the 24-hour clock or military time. L'heure documentée, faut noter l'heure là. You must note the time. It can be military time or it can be conventional time. Heure la capable heure militaire. Wap suivre boss papa. Heure la capable heure militaire ou heure conventionnelle. OK? Qui joue en les petites? Was soit ba prêt avec son flanc l'autre tabak moi. OK. Battery. Tant qu'on pointe dans soleil. Okay. So you have to write the time. Okay? Now, page 19, heure militaire yo en dan, en blanc et en gris dehors. Okay? The military time is inside. 0-100 hours, 4-0 ça yo marqué minuit. The 4 zeros is midnight. 0-100 hours, that's 1 a.m. 0-200 hours, 0-200 hours, that's 2 a.m. 0-300 hours, that's 3 a.m. 0-600 hours, that's what? 600.
600?
6 a.m. 0-800 hours, that's what? 800 hours. Ah, my shit. 0-900 hours, that's what? 9 a.m. 1100 hours, that's what? 11 what? 11, maman. Achevez, faites quoi? That's Papa. 1100 is 11 a.m. Par en dedans, you say AM. Inside is AM. Right? Orange, you say heure conventionnelle. The orange one are the conventional time. Outside, the gray one, ça qui grille dehors, c'est heure militaire. Okay, 1200 hours, that's what time? 12 noon. C'est midi. 1300 hours, that's what? 1 p.m. En français, nous t'avons dit 13 heures. Right? But in English, we say 1300 hours. Okay? 2 p.m. 1400 hours. Kali jo nan liv la pou ka kompren. Okay? 1400 hours, that's 2 p.m. What time is 1500 hours? Huh? No. If 14 is 2 o'clock, 15 is what? 3 p.m. 1600 hours is what time? 4 p.m. Good job. Well, il tout collé avec ça correspond avec là. 1700 hours is what time? 5 p.m. 2100 hours. 9 p.m. Very good, very good. Nous commençons à comprendre. Alors, information ça, il faut retourner sur yo, à réviser yo pour qu'à bien saisir. Non, c'est normal. C'est ça fait faut retourner sur lui. Est-ce qu'on a fait tout cet après-midi avant la donne? N'entends pas, il faut retourner sur lui. Mais, c'est pas trop difficile passer ça. Là, c'est pas trop difficile. OK? OK. Eh bien, ma copie là? Reste à son seul page, l'île la même. The rest is just one page, it's in your hand. So, terminologie yo, terme yo écrit dans feuille ça, ou pour aller mettre sous papier dans livre et dans cahier pour écrire définition yo qui dans chapitre 1. Okay? So you write the definitions for these terms on the page. Okay? Ou pas attendre? Terme vocabulaire mettez dans papier ça yo, dans papier ça, ou apprendre vocabulaire ou pour aller écrire définition dans chapitre 1. Nous sommes là, aussi simple que ça, OK? Heure militaire là, le matin c'est de 0 à 100. So 100 hours, that's 1 a.m. 200 hours, 2 a.m. 300 hours, 3 a.m. 400 hours, 4 a.m. 500 hours,
5 p.m.
not p.m. a.m. Right? 600 hours,
6 a.m.
6 a.m. So when you get to 12, they put it to 1200. When you get to 1200, that is 12 noon, midnight, midday, midi. Okay? 12 noon, 1200 hours. Now, pour PM, non, ou pas retourner à 0. You don't go back to 0. You keep going up. Qu'est-ce qui vient après 12? What comes after 12? 13. So you will say 1300 hours, right? 1400 hours.
1500 hours. 1600.
Exactly. Okay? Alors, m'a tout annoncé qu'on va pas prendre deux langues là. You're learning two languages. You're learning American English and you're learning healthcare English. Ou pas c'est ça? On va pas prendre terminologie médicale et langue anglaise. Si vous appliquez tout, non, badge parler langue. Right? So you're learning American English, Fatoumata, and healthcare English. If you apply yourself, in no time your English is perfect. And you can get the job and make the money and bring teacher the money. No? You're lying. All right, guys. Thank you for coming in. Thank you for being here. You're welcome. All right. All right. And thank you, people on Facebook. All right. Thank you, Mr. Mannequin. And thank you also, people on YouTube. YouTube means Facebook, Facebook means YouTube. Okay. Merci bien. All right. And stream.